Dr. Vuong, do you see children? I mean, you did say you see children in your practice. So tell us a little bit, what should moms who may be expecting a child or have a child, do you have any advice for them how they should go about preparing the child for the dentist, when they should go, what they should do, things they should do or not do with their child? Do you have any advice like that?
Oh, definitely. At our practice, we see a lot of kids. I would say maybe 40% of our practice consists of kids. And when I say kids, I mean 18 and under. But there's quite a few kids that are real young in our practice. We start with kids that are just 6 months, and we have them come in, and we start with the education process, the family education process, on how to take care of these young ones, and how to teach them how to prepare for their first dental visit, and what to expect in a dental visit. A lot of it is, just having the parents work with the kids, tell them, what to expect at the dental office, maybe read them a story about going to the dentist, or watching a video about going to the dentist, and just preparing them. And even when you do that, not all kids are ready right away. Some just takes a little bit more time. But, we always encourage the parents to start right away.
Well, I suppose when you get a child in at 6 months, even 1 or 2 years, 3 years maybe, I really don't know. I assume really not much dentistry has to happen with them. So it probably boils down to making them riding up and down the chair, count their teeth, helping them counting their teeth, seeing how mommy or daddy sits in the chair and survives it. It kind of like, it's just because I assume there really isn't on an average that much work with up to a few years, or am I wrong here?
You're right and you're wrong.
Okay.
I would say 80% of the people have 20% of the cavities. And 20% of the people have 80% of the cavities.
Okay.
So, for example, let's say we see a 2-year-old, maybe 8 out of 10 don't have any problems.
Got it.
Or have very few problems.
Right.
And the 2 out of 10 have massive dental decay.
Got it. Any reason for that? Rather than maybe, and I'm sure it has some. I'm not sure actually that there's some genetics in it. But is there any other things which maybe the parents do or don't do, which can cause that?
Oh, definitely. I would say besides genetics is definitely a part of oral diseases.
I blame all my shortcomings on genetics, all of them.
but I would say genetics maybe only 50% of the equation. The other 50% is how you take care of the teeth. So we get some young mothers that perhaps they don't know how to properly take care of their kids, or how to properly brush.
Well, tell us some of those improper things they could potentially do. Tell us the things they shouldn't do, maybe. Because telling them to brush, to take properly care, that's like telling somebody to eat good food. I mean, to some of us, good food is pizza, donuts, Coca-Cola, and whatever, something like that. And apparently that's not right. So what are some of the actual things a parent could do or shouldn't do?
Well, one of the things that parents can do and should do is definitely when the babies start getting their first teeth, you have to use a washcloth or maybe a toothbrush and just start brushing and cleaning around those teeth. And as they get more teeth, you just keep on going and keep brushing and flossing and cleaning around the teeth. And one other real common thing that I find with the kids that have a lot of caries is baby bottle syndrome. That means they're going to bed with a bottle in their mouths, and the bottle usually has milk or juices in it, and both milk and juices obviously have sugars in it. That's what's causing all the dental decay.
So basically we learn, obviously, that we should brush after every meal, but at least we should brush at night and, so that during those 8-10 hours, the teeth are clean and all that stuff is away. So if you send the baby to bed with a bottle, milk, because milk is very sweet, very acidic, it has all that stuff in it, right? Because sugar is acidic. And so basically you're not only not brushing, but you're soaking them in that stuff.
That's right. But basically, the equation for cavities is real simple. It's bacteria plus sugars equals cavity. Right. So pretty much everybody has bacteria, and if we can eliminate the sugars, then we can eliminate the cavities. Mm-hmm. Now, a lot of people have problems eliminating the sugar, whether it's from juice, milk, candy, or just food stuck in the teeth. That's how cavities form.
Right. Got it. Okay. So that's some of the stuff. Now, all right, good. Let me ask you another question here, though. How important is it to maintain the baby teeth? Because, I remember when I grew up, and I never had to wear braces or so. I think somebody up there in the sky was really gentle with me. But I do know that in my house it was, a tooth is a little loose or whatever, or it hurts, the baby tooth. I really do remember that. And my father making a big, beautiful, wonderful, smiling and funny event out by literally, I'm not kidding, putting a string to the tooth, the door, and he made me, pushing the door, not him. And so I was at cause. I was pulling out my own teeth. That was our going to the dentist during the baby teeth season. They did stop. Is that a good way to go about it?
No, definitely not. Definitely not.
It was fun, though. I'm telling you, it was fun. We had fun with kids.
You definitely want to, take care of the baby teeth, even though the baby teeth are really your first set of teeth, but you want to be able to maintain them long enough where the permanent teeth can actually come into place and replace the baby teeth. Many kids lose their baby teeth early, and then you'll start to have the permanent teeth being blocked out and have no place to actually come in. So a lot of parents don't.
How can that be if they lose the tooth early? There's nothing there to block the tooth.
Well, once you lose a baby tooth early, you have the tipping of adjacent teeth, which blocks out the space for the permanent tooth to come in.
It's just like when you're an adult. You explained to me when a tooth is missing, then the teeth start tipping, and the whole mouth gets out wacko, and you get headaches and stuff like that. So when a baby is, when a young child, when that happens, the tooth is blocking the other tooth from coming out, and that other tooth starts coming out crooked, I assume, like a tree. When there's something in front, it just grows the other way around, and thus, all of a sudden, a $6,000 orthodontic bill comes about.
That's right. Sometimes it just comes out to the side. Sometimes it doesn't come out at all. And, in order to prevent that, we got to really take good care of the teeth. And if somehow one tooth is not savable, we need to go see the dentist so that we can actually make a space maintainer to maintain a space for the permanent tooth.
Got it. Okay. So basically, just like as an adult, do maintain them, and only because they're baby teeth, they do apparently have their function. You've got to keep them and maintain them. And obviously, a baby tooth can hurt too, right?
Oh, definitely. There's a lot of kids that are, that have a lot of toothaches, but the parents can't afford to get it fixed because because they have too many toothaches and too many teeth. That are aching,
right,
that are needing dental work. So I highly encourage parents to actually take care of them and take care of all the little problems before the whole mouth gets infected.
Because again, instead of pulling that tooth out and then having the problem you just mentioned with teeth coming out crooked or not at all and all kinds of ways, you're gonna have an ugly-looking teenager who for sure needs braces, and even if at that time and point you do have some money, you'd rather go to Hawaii with it than putting it in braces on your kid.
Definitely, definitely. And not only that, it saves you time.
Sure.
Sure. Time and pain and all that.
Sure.
Yeah.
Yeah, and
So it's
not just and also the kid. I mean, braces these days become some type of fashions to a certain degree. But I don't know. If I would be a kid, I rather if I don't have to, I would be just fine.
That's right. Why get something that you don't need?
Yeah, tell Daddy to buy me a bicycle. It's much better. All right. Thank you very much, Dr. Vuong.
Thank you, Helmut.